When you think about health research, do you imagine scientists in white lab coats working with test tubes, microscopes, and rats? Did you know that not all health research happens in the lab? So not all health questions, are answered by research in a lab.
Absolutely. And in fact, I don't work in a traditional lab at all. My lab is the community, everyday society.
And what does that involve?
There's a whole gamut of what it can involve. It can involve looking at large data sets. It can also involve working in the community and interviewing people.
Now, everyone always hears about randomized controlled trials, RCTs. Why are they important?
Well, randomized control trials are really the only design that can talk about causation. In many cases, we do not use a randomized control trial, but it's a very powerful research design that can get at effectiveness. So which medication is the most effective for a particular condition or a disease, for instance.
Now you do research involving in videos. How do you do that, and how do you do research on the effectiveness of those videos?
Great question. So we actually work with members of the community to develop the videos. We interview parents and understand their experience of having an ill child. We involve the parents in the development of the videos, and we also integrate the best available synthesized research in the content. Then when we develop prototypes, we feed it back, and we get parents' opinions on the usability of our tools.
So even though this isn't an intervention that most people would think of as a healthcare intervention, it is,
yes.
And it's science-based.
Absolutely. And in fact, we used a randomized control trial in one of our research studies where we randomized groups of parents to receive one of our storybooks, and another group of parents received the standard information sheet. Parents wanted the storybooks.
So even though this research isn't done in a lab, even though this research isn't done in a clinic, it's important.
It's critically important. What we're learning from our work is that parents value and appreciate the emotional reassurance through our videos that we develop. They feel empowered to be able to take care of their child, for instance, at home.
So do you think it's important for people to understand that there are different kinds of research approaches?
Absolutely. It's critically important. We actually want members of the community to get involved in our work. We want to have participant and community engagement happening so that we can co-develop knowledge.
So not all research involves rats, microscopes, or white coats.
Exactly. And the work that I do is testament to that. No rats, no white coats.